Asthma and COPD, chronic obstructive pulmonary disease, are both chronic respiratory conditions that affect millions of people worldwide, but they differ significantly in their characteristics and impact on patients' lives. Asthma typically presents with symptoms such as wheezing, shortness of breath, chest tightness, and coughing, often triggered by allergens, cold air, or exercise. COPD, which encompasses emphysema and chronic bronchitis, manifests through persistent respiratory symptoms like a chronic cough with mucus, shortness of breath, and frequent respiratory infections, generally worsening over time and mainly caused by long-term exposure to irritating gases or particulate matter. Treatments for asthma include inhalers to manage and prevent symptoms and medications to control inflammation, while COPD treatment focuses on smoking cessation, bronchodilators, corticosteroids, and in severe cases, oxygen therapy or surgery. Risk factors for asthma include a family history of allergies, frequent respiratory infections during childhood, and exposure to environmental pollutants, whereas COPD risk is strongly associated with smoking, long-term exposure to harmful pollutants, and genetic factors in some cases. Here's detailed aspects of both asthma and COPD, revealing their distinct paths, management strategies, and impacts on health. Onset of disease, childhood versus middle age. Asthma often presents in early childhood and is characterized by episodes of wheezing, shortness of breath, chest tightness, and cough, often triggered by allergens, cold air, or exercise. Its early manifestation is linked to genetic predisposition and environmental factors like exposure to airborne allergens. Conversely, chronic obstructive pulmonary disease (COPD) typically emerges in middle-aged or older adults with symptoms, chronic cough, wheezing, and breathlessness, progressively worsening over time. COPD is strongly associated with long-term smoking and exposure to harmful pollutants. Distinguishing between them is critical as it guides management. Whereas asthma can often be well controlled with inhaled corticosteroids, COPD may require a combination of bronchodilators, steroids, and lifestyle changes such as smoking cessation. Triggering factors: allergic reactions versus smoking. Both asthma and COPD, chronic obstructive pulmonary disease, can be debilitating respiratory conditions, but they diverge significantly when it comes to triggering factors. Asthma is commonly associated with allergic reactions and is often triggered by environmental factors such as pollen, dust mites, pet dander, or mold. These allergens lead to airway inflammation and constriction, causing asthma attacks. Conversely, COPD is most frequently linked to long-term smoking, which causes damage to the lung tissue and airways over time. Exposure to other lung irritants like pollutants, chemical fumes, and dust can also contribute to the development of COPD. The distinction in triggers is crucial for correct diagnosis and treatment. Associated symptoms: atopy versus chronic bronchitis. Asthma and chronic obstructive pulmonary disease, COPD, share respiratory symptoms but differ in their associated characteristics. Asthma commonly ties with atopy, sensitivity to allergens leading to heightened immune responses manifesting as eczema, allergic rhinitis, and conjunctivitis. These allergic predispositions are less pronounced in COPD. On the contrary, COPD, particularly chronic bronchitis, is characterized by a productive cough with chronic mucus production, a consequence of prolonged tobacco exposure or environmental pollutants, typically absent in asthma. Recognizing these divergent symptoms is pivotal in diagnosis and tailoring treatment, as asthma leans towards inflammatory control, while COPD management revolves around improving airflow and reducing exacerbations. Airway response: reversible obstruction versus irreversible damage. Asthma is characterized by reversible airway obstruction, meaning airflow limitation improves either spontaneously or with medication. In asthmatics, airway inflammation leads to episodes of wheezing, chest tightness, and shortness of breath, which can vary in severity and frequency. In contrast, COPD, chronic obstructive pulmonary disease, typically involves irreversible damage to the lungs. This damage is often a result of long-term exposure to irritating gases or particulate matter, most commonly from cigarette smoke. COPD is hallmarked by a persistent reduction in airflow that worsens over time and is usually not fully reversible, even with treatment. The differentiation in airway response is crucial because it influences the management and therapeutic approach, for each condition. Associated symptoms: atopy versus chronic bronchitis. Asthma is commonly associated with atopic conditions, eczema, allergic rhinitis, and seasonal allergies, playing a significant role in the asthmatic response. The immune system's hypersensitivity leads to bronchial inflammation upon encountering allergens, with symptoms like wheezing, chest tightness, and varying degrees of breathing difficulty. In contrast, chronic obstructive pulmonary disease, COPD, specifically chronic bronchitis, is characterized by a persistent cough with mucus production, resulting from long-term exposure to irritants such as tobacco smoke. While asthma symptoms are episodic and often reversible with treatment, COPD's airflow limitation is progressive and typically irreversible, escalating gradually over time with exacerbations and a more constant state of respiratory discomfort.